I'm joined here with Adis Rublo Mason. She is a staff pharmacist at a retail chain. And what is your job title at Walgreens?
Well, I am a staff pharmacist now here at Walgreens. I work about 4 days a week here.
Okay. Do you live in the area?
Well, I do travel to get to work. I approximately live about 30 minutes away from my job.
Were you born in Texas?
No, I actually was born in St. Louis, Missouri, but my entire family's from Louisiana, so I spent a lot of time there.
Why'd you move to Texas?
Well, my father is an engineer, so he was transferred with his job when I was in high school.
Okay. What are your duties as a pharmacist?
We actually have a lot of different duties, but our main focus is to do drug utilization, where we check patients' prescriptions, make sure they're getting the right medicines and dosages, and how they understand how to take them.
Has Walgreens added any additional duties as a pharmacist?
Yes, we have plenty of additional duties. We do blood pressure screenings here. We also do immunizations here, certified immunizer. We also do blood glucose testing here. So we do a lot of different things here. Yeah, that's intertwined.
Did you always want to become a pharmacist?
Well, not necessarily a pharmacist. I did know that I wanted to do something that helped people, and I did lean more towards the medical field once I was in, I guess, about high school.
What made you choose the medical field?
Well, my cousin is a nurse, and she always kind of, would say something about nursing, to kind of, get you interested. But after that, it was just, once I got to school, I was like, I really think that's what I want to be.
Did anybody influence you to join the pharmacy career?
Well, not necessarily pharmacy, but I did have a really good support system growing up, really good teachers, and they basically just let you know that you could do anything that you wanted to do, as well as my parents.
Describe your education. What degrees do you have?
Well, my main degree is a Doctor of Pharmacy degree that I received from Xavier University of Louisiana, located in New Orleans, Louisiana. As well as, immunization certifications, diabetes, blood pressure screenings, we do those,
Did you take any special courses after you got your degree?
Yes, my additionals came from our added job duties here at the store. And then I'm working on a couple things that are outside of job.
Okay. Was the communication course required?
We did actually have to take speech and communication, both in the junior college that I went to, it was College of the Mainland, and I also at Xavier University.
Okay. Do you plan on continuing your formal education, get more degrees, or?
Well, I'm not too sure if I want to do more degrees, but I do a lot of continuing education, and then when I see other things that are locally that I really want to pursue, I do tend to go ahead and search those out.
Okay. What do you like most about your job?
I really like the patient interaction. That is probably the best that I really like that. Getting to talk to people because you're meeting a need for them. And so a lot of times you're not just the pharmacist, you're a counselor, you might be a listening ear to an elderly person who doesn't have, a lot of family around. So you play different roles, yes, and so I kind of like that.
Okay. What do you like least about it?
The stress involved. I mean, you're constantly going, so you're very analytical in the way you approach things. So, you're having lists constantly in your head that you're checking off to make sure that you're completing, just because you're going so much, between checking prescriptions, counseling patients, speaking to people on the phone, to doctors, nurses. So you have to have a wide range of communication skills to talk to patients in layman's terms, but then be able to communicate with physicians and nurses.
How's the multitasking at a retail pharmacy?
You definitely have to know how to juggle more than one thing at a time. Because normally when you're at a pharmacy, there's usually just one pharmacist on duty. So you're being pulled by every other person in the pharmacy to help meet their needs as well as the customers. So you have to quickly prioritize those things, and then go down the list until everyone's, been helped.
How has technology helped you as a pharmacist?
It has helped a great deal. As far as one, checking the prescription. Something simple as being able to have a visual image of a medication. It'll come up on my screen, because otherwise there's no other way for me to verify it without going and actually looking in the bottle. So that actually puts, it takes a lot off of us to have to do that. So something simple like that really, really helps. But everything from the beginning process to seeing the scanned image of the prescription, all the way down to being able to counsel patients, checking drug interactions. Now I'm not just solely relying on my memory. I actually have all the resources there at my fingertips to pull them up quickly and to being able to analyze the information and use it.
What kind of challenges do you have as a pharmacist communicating with the patient?
Well, because your patients come from all backgrounds, different education levels, different cultures, you have to try to get a certain type of information so that they can understand it. I've had deaf patients, being able to have the communicating through the touch tone system with them. You have to be able to communicate with people who are different cultures. They receive women differently, or pharmacists differently. They also, the language barrier. Houston has a lot of different cultures, and you run into, a lot of different people. So even if they may speak English, their cultural influences, they come at you, and you have to kind of interpret that as well.
Okay. As a pharmacist, how have your perceptions changed? Before you became a pharmacist, what were your perceptions of the job, and how have they changed now that you're a pharmacist?
Well, I actually had two different areas that I was going to go into. The first was clinical pharmacy, and I spent a lot of time in the hospital rounding with physician teams, and meeting patients that way. So I didn't have as many patients, but I had a lot of professional people that I was around. So I had one kind of aspect to it. But once I graduated, I did go into retail pharmacy, where you are completely in the public, and your job duties are completely different. So you do have, sometimes you have a Superman or superhero, feeling when you graduate. You like, I have this. I'm going to change the world, and they feed that into you in school. So when you're ready to go, you're like, yes, I'm going to do this. And then you're like, whoa, you're faced with this huge healthcare machine, and you're like, wow, what do I do now? So it has changed. I not always saying, okay, I'm going to change the world, but I'm going to change someone's world. Whoever